Rajim. Bismillahirrahmanirrahim. My name is Dr.Ghulam. I am a cardiologist. We are here in Pakistan. I belong to Bajawal. This video should be included, not to be not so good in English, but the first 5 minutes portion may be in Pashto, because we just want to show one patient to the world. One can translate these words into English, because we have a patient, 26 years old, here today, his second visit, and about 40 days back he was first for executive examination at my clinic, Pakistan. We will be asked from the patient, and we will be just give the history after now what improvement when the patient now feel. He was labor at Saudi Arabia. He's belong to Shangla zone in Pakistan. Shangla is a district of KPK. KPK is the province of Pakistan, Great Pakistan. سر تاسو نوم چې دی نو غفور رحمان دی. تاسو د شپږ کال 26 ایرز تاسو چې موږ کتلی وای نو تقریبا 40 ورځې وشوې. ستاسو په ملا کې دړو د 9 کالونه او د 2 کالونه د معدې درد او د سکین الرجي وته، خولې دې راتلې، معده دې خراب وه. اوس دغه دردونه څنګه دي؟ ښه دي؟
ډېر زیات ښه شوي دي.
څومره ملا کې جوړ کوم ځای درد؟ په لاس کې
ملا کې دا ځای
او دا ځای او ستا 3 غاښونه مس دي. او اوس د معده څنګه ده؟
معده مې بالکل برابر ده، معمولي ونې فرق دی، بس سیټ یم.
بیا ته سعودي عرب کې هم ډاکټرانو کتلی وي؟
سعودي عرب کې خو دا غاښونه مال ایستلي وو.
غاښونه سعودي عرب کې ایستلي. صحیح شو. Okay, now he says I am 50% okay. There was skin allergy, there was irritation. Now he says I am 50% okay. Actually, let's see. I want to discuss these some health problems, because I am cardiologist. Why we suffering of coronary heart disease prematurely? Why we suffering of back pain? Why we suffering of corona? And why we suffering of different infection? Why there is so many depressions? And why we have gastric problems? Why we have some malignancy? Let's see. For me, let's see to discuss first the just for the human being, also animal. We just need a normal diet. And the best book for the treatment is Quran and Hadith, because there is no other book other than Quran and Hadith, because all these including in Quran and Hadith for the different health problems, also to enter to Jannah. Let's see, we want to discuss the modern science in the old theory, because that was 1921. The McCollum given butter to the rats, and the rat was weak in eyesight and weakness when given the butter. Because I am making this video in English, because there are so many people which comments on my video in different languages. They don't know proper Urdu and Pashto. So I am accepting my English is too much not good, because we have just learned from school. And anyhow, I'm accepting. I'm so not good and fluent English, but anyhow, I will be explained, try to understand for the whole, because this video is for the whole world. So that McCollum butter given to the rats, so the rat become healthy and the vision improve. When they heated the butter and again given, the rats become blind again and they remain healthy. They label just this butter now. The first you think this butter contains fat soluble vitamin A. When again given heated butter, the vision loss in the rats remain healthy. they first they label that contains fat soluble vitamin A, but when they lost again the vision, they label no, this is not fat soluble vitamin A, this is just D. Then again that again started given started better and without heating, and the rats remain healthy and uh, with normal vision. Then at the end, someone draw a proper pathway. Okay, this is actually the ultraviolet B rays. When they hit the skin, they making the bone vitamin. So far, the world don't know what is the substrate, what is the thing in the skin. When the skin hit by the ultraviolet B rays, and that converted to cholecalciferol. So that is cholesterol. So all the human beings in the world, all the females in the world, when they are deficient with bone vitamin, the 60 to 80% baby are born in the hospitals or clinic. When some female is sufficient with bone vitamin, there is 400 chance that baby will be normal deliver in the home. Anyhow, there is other indication for hospital delivery. Then when the baby is born, the mother milk is deficient with bone vitamin and magnesium. So the baby should be loaded with 2 lakh international unit bone vitamin, and after that should be given 800 to 1000 unit of bone vitamin daily up to 5 months. After 5 months, the International Light Association recommend that the skin of the limbs should be exposed 5 minutes for 5-inch skin should be exposed for 5 minutes daily up to 15 months, and after 15 months the limb skin should be exposed 10 minutes daily up to 3 years, and after 3 years the whole body should be exposed for the sunlight. The white people just 15 minutes, in the black people 1 hour, in for the Asian is 45. But the skin exposure is not allowed in public places. Anyhow, the limbs and arms one can expose in the home. So the theory is there is a ultraviolet B rays in the sun. When that sunlight ultraviolet B rays hit that skin, the skin contains the basal layer and spongiosum layer. So when they hit the ultraviolet B rays the skin, the 7-dihydrocholesterol is converted to pre-vitamin D3, and this pre-vitamin D3 after isomerization in the skin go to the liver, and there is first hydroxylation, and that converted to D2, and the kidney there is second hydroxylation, and that converted to hormone D. If someone is not use direct sunlight on the skin, the 7-dihydrocholesterol is converted to cholesterol, and there is hypercholesterolemia, increased fats, and they lead to cardiovascular diseases just like acute coronary syndrome or heart attacks, and CVA and peripheral vascular disease and carotid artery disease. Well, let's come to the limb. What is the function of hormone D in the skin, in the intestine? They absorb the calcium for the bones and teeth, and absorb the magnesium. So the not proper use of magnesium in children, there is increased salivation and sweating and autism, and the cochlear vestibular nerve become weak with growth. So there is vertigo in the children group. In the adult there is dizziness, vertigo, sorry, not the dizziness is cardiac problem, and there is tachycardia, palpitation, and depression, anxiety, and loss of appetite, and obsessive compulsive syndrome, and the person is not able to tolerate to present something in the meeting. They become tense, and there is anxiety and depression and muscle weakness, so hernias, and there is the cochlear nerve become weak, so early deafness and palpitation, phobias and whitening, and hair fall, and sleep problems, and headaches, and bedness in the mouth, sweating and burning soles, and loss of appetite, and mania, and suicide thoughts, and homicide, and some dementia, and also some psychological problem. This is all because let's see summarize the bone hormone absorb the calcium from the bone intestine, so they for the bones and teeth in the cells, and they absorb the magnesium. So the magnesium not using, so creating these problems in the human beings, maybe in animals. And also when the bone vitamin deficient, there is no proper use of the zinc in the body, so the immune system become depressed. So the world is suffering of corona, tuberculosis, asthma, throat infections, rheumatic disease, different types of allergies, just like the history of this young boy, and some cancer like colon, prostate, thyroid, and some breast carcinoma, in psoriasis, vitiligo, in diabetes mellitus, multiple sclerosis. Let's come to the another limb. When the bone vitamin hormone D become deficient, the human animals need calcium for the bones and teeth and every cell of the body. So there is increase of parathyroid hormone. The parathyroid hormone is called thief of the bones, or the rat which is eating the roots of the tree. Now this parathyroid hormone is trying to produce calcium for the body. So they removing calcium from the bones to fulfill the needs of the rest of the cells of the body. So the bones become weaker. So there is records in even in sunny countries which is unacceptable. Osteomalacia, osteoporosis, joints pains, back pains because the vertebrae become weak, and teeth problems and short stature if someone not used before the age of 16, and deafness because the ossicles in the ears become soft, so there is early deafness. In the renal tubule, there is a no reabsorption of the calcium from the renal tubules in the presence of secondary hyperparathyroidism, so they lead to renal stone. As so anyone in the world, when they normal up to 16 years, then the bone density start to decrease. 1% bone density is lost in the male, and as compared to male, 6% more than 6 times bone density loss in the females. If someone reaches the age of 30 years, the bone density 12% loss, bone density is lost in the males, and 26 times more in the female. It means the bone density is more decrease in 6 times more decrease in female as compared to males. In someone if reached the age of 45 in the female or become postmenopausal in the male androgen deficiency, they lead to osteoporosis. Uh, sorry. So in the world, especially in Pakistan, I have noted when most of the people using steroids for the bone pain, even for the allergy and asthma. Actually, when the bone vitamin is increased, the steroid should be given because steroid is called enemy of the bones. So, for the human beings, the bone vitamin, what should be the level, what should be the need. Actually, the world recommend different doses, but for me, at least bone vitamin dose, I am not agree that the level should be at this level कि someone not feel any body pain, back pain, bone pain up to age of 60 years. But anyhow, the world recommended dose is a 1000 to 7000 units of bone vitamin daily in diet. Anyhow, the plasma half-life of bone vitamin is just 14 days. And for me, because my clinic is a research point in Pakistan, I have the data of more than 14,000 people. Out of 14,000 people, just three people, one is from the child group and two from the adult group. with sufficient vitamin D. All of the rest are with severe bone vitamin deficiency. Even I have one patient with level just 0.9, and I have two patients which is I awarded 7,000 Pakistani from my pocket, because in Pakistan people call me a crazy doctor and vitamin D doctor. Anyhow, I like this name because there is no such name of any doctor in the world, vitamin D doctor or crazy doctor or pagal doctor. Anyhow, there is this is a reality in the world. Most of the people are against honesty and fact. Now come to the Quran and Hadith. Actually, the human being anywhere in the world need a normal diet. So the normal diet is that is the diet which was called, that was natural diet. Man salwa is mentioned in Quran. Man salwa, man that was the honey, and salwa is that was special birds from the God for Bani Israel. And the second thing, the God allowed to eat all the things except those which is without Allah Akbar, and the pork and the flowing blood. And then some ethnicity people of the world refuse and they insist to eat the pork. So the God banned to eat fats in Torah. Then in Quran, there is Surat Anam, ayat number 146. The God advised, وَلَلَّذِينَ هَادُوا حَرَمَنَا كُلَّ ذِي ظُفُرٍ وَمِنَ الْبَقَرِ وَالْغَنَمِ حَرَمَنَا عَلَيْهِمْ شُحُومًا وَإِلَّا مَا حَمَلَتْ ظُهُورُهُمْ مَا بِالْهَوَىٰ. You can eat only fats which is attached to the bones of the back and the entrails. So I think why the fats is banned on some ethnicity people. That was the secret of the God. There was some special group of young people which were called Aswabika. When they were sleeping in the tunnel, as is mentioned in Quran, Aswabika, ayat number 17, they were sleeping for more than 309 years, and that was the diversion of sun rays from the skin of Aswabika, because as is mentioned in different tafasir of Quran, the one mouth of the tunnel toward the north and the second to the south. If the tunnel mouth to the west, there was more chances to not survive that Aswabika, because there is a chance of direct sunlight on the skin. So that was the special secret of God. They were protected from the sunlight for more than 306 years. And there one dog, when they near were to start the barking, the God banned to no barking. And there is a hadith Bukhari ki the book name is Kitabul Libas, the page number 383. कि when some male man asfala min kaben fil zari fil nar, when some male is walking, the male should be exposed the skin of the ankle area. If that skin is not exposed, that area will be not go to Jannah. So there is maybe other benefits in this hadith, but this is definitely, if that skin is exposed during walking, there will be definitely the skin should be hit by the sunlight of the sun. So the ultraviolet B rays will be hit the skin, and the 7D hydrocholesterol in that portion of the skin should be converted to cholecalciferol, and that cholecalciferol will be absorbed the calcium from the intestine for the bones, teeth, and rest of the body, and that cholesterol will be not remain high. So there will be less chances of cardiovascular diseases like heart attack and CVA, and there will be absorption of magnesium in the presence of bone vitamin. So there will be no depression, no sweating, and no anxiety, and no early widening of the hairs and fall, and no constipation, and no phobia and no depression, as I mentioned. What is the function of magnesium, as I mentioned. And there will be a proper use of zinc, so the immune system should be normal. Also the sunlight, when they hit the skin, there is a increased nitric oxide level, and the nitric oxide is called vasodilator, which is decreasing the blood pressure if someone is hypertensive up to 10 millimeter. They also increase the lethicidine, and lethicidine is a killer against microorganisms. They also stimulate the lymphocytes, so the lymphocytes are the fourth line of defense. So actually now coming to the corona, because the corona actually, the definition is the corona, actually the white luminous circle around the sun is called corona. So that was the time when the Fenson, who was the scientist, he was treated the lupus vulgaris first with a good diet and sunlight. Lupus vulgaris with sunlight, who was awarded a Nobel Prize. And now we come to, because there is two groups of people in the world, that is Jews, Christian, and the Hindu, who worship of the sun. And there was also a theory of heliotherapy. That was 1961, when the Greece people, they exposing the babies to sunlight. Look at these babies. And heliotherapy, the boys, when the boys they improved, they again started God is the sunlight is our God. So anyhow, no one is thinking why there is sun light in this earth, and why the sun arising from the east and they go to the west, because we all need sunlight for healthy life. Anyhow, there are other health problems, just like genetic problems or chromosomal or glycogen storage diseases, and age-related diseases. But personally, I'm my clinic is a research point. I belong to Pakistan, Bajor. I am a cardiologist. But in the world, so far, I have studied all the literature. The cardiovascular diseases and CVA and diabetes mellitus never come before pain in the back, pain in the bones, pain in the body. And yes, there is some diabetic babies, but if the mother is normal with bone vitamin, there is very less chances of diabetic babies. And I think I am cardiovascular because I am cardiovascular doctor, because I think the muscular obesity one can decrease, because magnesium, as bone vitamin absorb the magnesium, and magnesium need for the muscle. So if I think this is my thought, I may be not on this earth, because we should all will be die. Because that mother, if sufficient with bone vitamin, maybe there is less chances of muscular obesity and ASD secundum, because that baby need muscle and magnesium. So I have given this lecture. I will be share. And anyhow, my picture is this. I am adult cardiologist from Pakistan. Anyhow, this is very very interested. This was the X-ray of this boy, 3123. These were the vertebrae. Look at this. Now after 1 month, the level of bone vitamin in this baby was male just 20. Today is 56. Should not be less than 75. So please try to use sunlight. I am inviting all the people from the world to come to Pakistan. We are very good people. We are friendly people. We are all the natural sources. We have good points for the visitor, and we are as the sunlight of Pakistan is very safe. There is no risk of skin cancer. One day, inshallah, this sunlight of Pakistan will be the main source of income of Pakistan. Okay, thank you. Any comments from anyone should be appreciated. Again, I am sorry. I am not good to explain in proper English. Again, I am sorry if someone anyhow objection. Again, I am sorry. So actually, this man that was premature severe osteopenia and loss of these vertebrae and weakness of bone because of age as is 26 29 and severe bone vitamin deficiency because bone vitamin become deficient, not using 1000 to 10,000 units of bone vitamin, not using sunlight on the skin, so the parathyroid hormone increase, they doing with the bone this magnesium decrease, that was allergy now no, and there was not proper use of zinc, so the immune system was depressed. Now my patient is okay. Okay, thank you. Assalamu alaikum.